going to be looking at drug abuse, the preventive measures to take, and also to bring to your doorstep everything you have to know about drug abuse. And joining me this morning on that conversation is pharmacist Francisca Wenjike. Pharmacist, good morning. Good to have you.
Good morning, ma'am. Thank you for having me. It's a pleasure to be here again.
All right, thank you for joining us. And so we're going to be looking at drug abuse. Before we go further to the preventive measures and how to identify drugs that how to identify that we have been abusing drugs, I want you to do a recap on drug abuse. What exactly is drug abuse, and how do one abuse drugs?
All right, thank you very much again. Before we get into drug, what comes to mind? Now, a drug is any substance at all, aside food, that has the ability to alter the state of the body. It could be physical states, physiological states, psychological states, or even the biological state of the body. Any substance at all that can alter the state of the body is known as a drug. Now, drugs are divided, broadly classified into three for the sake of this meeting, this presentation. Firstly, medicines. Medicines are the good guys in quotes, the ones you take that are used for prevention, for diagnosis, prevention, and management of illnesses. Those are medicines. For instance, the analgesics, paracetamol, ibuprofen, antibiotics, and the others that are generally used to manage disease conditions. They are known as medicines. And then we go to the socially acceptable drugs. They are legal, or they're social drugs. For instance, the alcohol, tobacco, that is the cigarette that you take. Those ones are known as the socially acceptable drugs. And then we go to the illicit drugs. Under the legal drugs, we still have control medicines that are sometimes used to manage pains and other conditions that the regular drugs cannot take care of. For instance, the opioids are used to manage pain. They are under the legal drugs, control drugs. And then finally, we have the illicit drugs that are completely banned. They are not. A research has shown that children from homes that their parents
Take drugs.
Yes, are likely to take drugs. And children who at a young stage start taking alcohol and tobacco are at a higher risk of abusing other hard drugs in future. So that's why we tell parents to lead by example. You don't want your children to do drugs, don't do drugs, and genuinely don't do it. Not that you go and do it behind them, because you definitely find out. Yes, so you might say that you take alcohol from time to take these drugs to feel good, just for that, aside health conditions. Now, using these drugs on your own, as for instance the alcohol, tobacco, that is the cigarette that you take, those ones are known as the socially acceptable drugs. And then we go to the illicit drugs. Under the legal drugs, we still have control medicines that are sometimes used to manage pains and other conditions that the regular drugs cannot take care of. For instance, the opioids are used to manage pain. They are under the legal drugs, control drugs. And then finally, we have the illicit drugs that are completely banned. They are not. It's not expected to be found with you. Now, coming down to drug abuse. Drug abuse simply means the use of drugs for purposes that they're not meant for, they're not prescribed for. Most times, people take these drugs to feel good, just for that, aside health conditions. Now, using these drugs on your own, especially those controlled drugs, are known as, especially illicit drugs, are known as drug abuse.
Okay. All right, you're giving up. Okay, you still want to go?
Okay, I think I'll just take a pause there.
Okay. I don't know if that's all you want to tell us about drug abuse. You were talking about the illicit drugs. That's the one that would take, or people take, to get high or to feel better.
Yes.
Okay. Now let's talk about the drug that is accepted, the one you use to treat yourself.
Yes.
Some persons overtake it. And we have the likes of tramadol, which is also to help for pain, I suppose. but people take it. Now, what would you say about that? Because
That
that tramadol is acceptable.
Now, when I was defining it, I said taking these medicines, it could be the opioids or this, like you called tramadol. Tramadol is usually used for pain when prescribed, when necessary. Now, the use of tramadol on your own is known as drug abuse. Usually take it to feel. And the thing with abusing these drugs is that you might start taking it maybe just to feel good, it makes you feel good, or to evade reality. Maybe you're feeling down, trying to fill a void, you're feeling lonely, and then you take this drug. With time, you still want to take it again. With time, you become dependent on it. That is, you cannot carry out your normal day-to-day activities without taking the drug. And then from there, you develop an addiction. An addiction simply means that there is compelling force, something compelling you to take those drugs, even when you don't have a need for them. When you know that the drugs would harm you, because most of these illicit drugs, of course, are harmful, you still go ahead and take these drugs because of the way they make you feel. So, yeah, that's
Okay,
drug
so
abuse.
okay, looking at the three classes of drugs that you just identified now, what are the effects of drug abuse on victims?
Okay, firstly, these drugs have a way of altering the mind. Like, you begin to see abnormal things as normal. Your thinking state, your thinking pattern is altered. So now the drug distorting the way you think would make you to be less productive. In fact, it can even lead to becoming should I say mad? I didn't want to use that, but let me just. It can lead to psychotic, psychotic problems. Lead to one developing those problems. And then
When you say psychotic imbalance, I want the layman to understand. It means when you're going crazy.
Yes, mental problems.
Mental problem.
Yes, yes, mental problems.
Okay.
And then coming down to the rest of the other parts of the body, your lungs. People who smoke, they are predisposed to coming down with lung cancer and other lung diseases. And then your liver too. The liver is one organ that is responsible for breaking down these hard substances, both alcohol, the normal medicines you take, these illicit medicines you take. So you overburden the liver, and so the liver begins to function less than it should. Yeah, and then drug abuse too can lead to death. That's the end state of it. It can lead to death. Aside other things that it makes you not to do your day-to-day activities as you should. You begin to have financial issues because most of these people who abuse drugs, they are not able to think up a source of income. So
when they get,
yes,
just go
everything
to drugs.
goes to the drug. When they don't have money to buy drugs, they go in and start to steal and commit other crimes just to be able to have access to these drugs. So these are some of the effects of drug abuse on the victims.
That's a scary one and dangerous, I would say, when it comes to death. But I just wish that process when people realize that it's going from one stage to the other, before it leads to death, they can be, caught and probably helped, before it leads to death, because there are stages before it gets to death. Death is like the final stage, the end bit of drug abuse. Okay, so how can this menace, this drug abuse, how can it be checked in our society, and how can we ensure a drug-free society?
Firstly is the awareness, which is what we are doing now. We have to continue to educate people on the dangers of abusing drugs. There's no benefit for drug use. You don't need it at all. If you want to feel high, like you want that endorphin feeling, there are other activities that can make you feel high.
Okay.
For instance, you could dance, you could exercise, all of those things. Think of the things that you're grateful for, that you have, the things you've achieved, and the ones you plan on achieving. In fact, continue to structure your life, set goals, even if you don't realize them at that time, the time frame you set for yourself. Believe that with time you achieve them. So all of those things can help to boost your endorphin level, and then you feel good about yourself without the need to use drug. Yes, parents as well, it's advised that we catch the children young. You don't have to wait for them to go out and be influenced by peers first. And then I want to point out that parents should lead by example. Don't be that kind of parent who says that follow what I say and not what I do. because the truth is that these children would always do what you do. So try to structure their lives, teach them how to write, how to plan their day, how to set goals, such that they are kept busy all through their day and there's no time to start thinking of all these harmful activities to do. And then there's this culture of the whites that I admire so much. They allow their children bring in their friends. This way they are able to keep tabs of everything that they do. So if parents can bring their children that close to them, these children would be able to open up to their parents when they come across friends who want to influence them negatively. When they see something that is not so nice to them, they would open up to their parents and then they discuss it. And then this also helps to boost this way they will boost the confidence level of the children, so that even when they go outside, when their friends are doing a particular kind of thing and they know that, oh, this is bad, they will be able to pull out and maybe look for another group of friends to join. Yes, that will help them. So these are some of the basics of preventing drug abuse. Yes.
So coming to the society now, you've talked about the parents. Let's talk about the society. What are the roles the society has to play in curbing the drug abuse menace? Because it is more in the society. How can they come in to help?
So the part of educating the society is not just for a particular set of people.
Yeah.
A child of one parent is child to all. So we should look out for, everyone is to look out for his or her neighbor. For instance, you see somebody exhibiting some attitudes that you know that are not normal with the person. For instance, a person becomes really clumsy, looking tattered. A person begins to talk, and you're asking this one, is answering another one. You should know that this person, there's a problem with this person. And then be kind to that person, first of all, because you know that these people, they don't have control over these things that they do. The drugs are controlling them instead. So if you can, you talk to them, advise them, and then also look out for government agencies that are in charge of this, handling this kind of issues. You could report to the police, or even take them to a rehabilitation center. I think we have one at Warri. So all of this, just look out for your neighbor and talk to them, advise them. Listen to good radio programs and stations like this one that we always talk about these conditions, and that way it will help you to be able to, yes, keep off drug abuse, and also help your neighbor to stay off drugs.
Well, I like the fact you said listen to radio stations like DBS.
Yes,
listen
like
to
DBS.
DBS will always bring that to your doorstep. All right, so what about stakeholders now? What advice would you give to stakeholders on this issue of drug abuse?
When you hear stakeholder, everybody is involved. The government, the health practitioners, pharmacists, doctors, everybody is in it. The government might come in by helping to create more of these rehabilitation centers, so that when we come across people who abuse drugs or who sell these drugs, we can take them easily to these people without having to travel far and wide to access the one that we have. Also, coming down to the pharmacy is usually the first point of call for most of these people who abuse drugs. Pharmacists are always on ground to advise patients on the use of these drugs. For instance, you're having pain, they come for tramadol. We advise them to take paracetamol or find the underlying cause of that sickness, not just to take care of the pain. It could be stress causing to the things they are meant to do and the things they are not meant to do, the friends they are meant to keep and the ones they are not meant to keep, as well as the things they are meant to ingest and the ones that are not good for them. Generally, do not take drugs on their own without being prescribed.
That's a good one. We know that drug abuse has eaten deep, especially amongst our youth. So those that are already affected by drug, those that are
reversible, you can be healed. So you might just usually these people, they hide away because of stigmatization and they don't want to be arrested and jailed and all centers. And you could also look out for those organizations that help to take care of people with these problems. Yes, so just come out And then
what if they don't want to come out now? Don't you have any agency that goes in search of these ones that have been abused seriously?
usually they are in hiding, so it is the
Okay.
responsibility is on all of us. If you see somebody behaving strangely, you could
You
even
report.
bundle the person, get the police to bundle the person out because they are not thinking straight. So
Yeah,
they
because they
depend
will
on
not
you
even want to
to.
come out.
Yes, yes. So you have to force them, get help to force them to go for these rehab sessions, because in that rehabilitation center they have everything that is needed to take care of them to get better, come out of it.
Okay, quickly, what factors would you say now actually pushes people into abusing drug?
Most of the time, like I mentioned earlier, it is usually they take drugs to evade reality. They're probably going through a hard time in their life, maybe family, finance, and all, and they just want to feel good. So they feel that taking these drugs would make them, it will temporarily make them feel good, but after some time it will wear
In
off,
the long run, yes.
and then they want to take another one. And
Okay.
with time, they develop tolerance to these drugs. That is, they require a higher concentration of the drug to be able to achieve that state that they want.
Yes.
Again, yes, so that
True.
can make people to abuse drugs. Peer pressure as well.
Okay.
Children go out with friends in school. You see your friends doing taking drug. You want to feel among.
Hmm.
So that is one of the
They just want
reasons
to
that
copy.
yes, they want to copy. And then from homes too, parents who abuse drugs. A research has shown that children from homes that their parents, children who at a young stage start taking alcohol and tobacco, are at a higher risk of abusing other hard drugs in future. So that's why we tell parents to lead by example. You don't want your children to do drugs, don't do drugs, and genuinely don't do it. Not that you go and do it behind them, because they definitely find out. Yes. So you might say that you take alcohol from time to time. It's not an abuse. Alcohol, as much as it is a socially acceptable drug, it's a drug. When you take more than 4 bottles of alcohol in a day, or more than 14 bottles in a week, you are abusing alcohol. That is for men. And then for women, if you take more than 3 bottles in a day, or more than 7 bottles in a week, you are abusing drugs. So they are all parts of drug abuse. So everybody has a role to play in it. Yes.
All right, thank you so much. So for those of you taking that black one and you say, oh, it's good for the tummy, please do not abuse it. One a day, it's okay, but not 7 a week. Not one every day. At least for a week, take one. It's okay. You have heard it. I've heard it all from pharmacist Francisca Nwejeke, talking about drug abuse prevention and how to help the society. Thank you so much, pharmacist.
Thank you.
We actually hope that when we call you again, you will be glad
Definitely.
to grace this
Always.
couch for us.
Always glad to come.
So the ride just keeps getting better by each second. And so on our next spot, we have a crop of professionals who will actually be celebrating the World Neglected Tropical Disease Day. And of course, you would ask me, what does that portend? And it's a program that has been set aside for the 30th of January every year. And it is a One Health approach in the elimination of neglected tropical diseases. And so joining me on that conversation, I have Dr. Yinka, Executive Director of Society of Nigeria. I'd like to welcome you, Buffet.
Good morning.
And
Good morning,
on the
Deltans.
extreme, so speak to that conversation quickly. What are NTDs?
Right, I'm glad to be here, and I want to appreciate the Delta State Broadcasting Service and the Ministry of Information providing us this opportunity to meet the public and also provide some information for them. And all of us know information is a very good way to go. And what neglected tropical diseases means is that it is a group of diseases that affect people in the tropics. Nigeria is in the tropics. If you look at the globe, there's a portion you call the equator, and then up above the equator, the Tropic of Cancer and the Tropic of Capricorn. Between malaria disrespect, because people know about malaria so much. If you ever somebody has malaria, can readily go to the hospital and get treatment. The other ones we are talking about here are like water related. Both think that they are all menstruating. Menstruation is for women in their reproductive age. And then you also have other ones like trachoma. If you go to northern part of Nigeria, like Borno State,
The elimination of this NTDs.
The One Health approach in the elimination of neglected tropical diseases is the interconnectivity of multidisciplinary sectors. That means different sectors, they have to come together to ensure that these entities are eliminated. So it's addressing that. They will help us to get water so that peoples will wash their hands after defecation. So, and we still these people still need to be treated also. So that's where healthcare will come in. So it's a multidisciplinary sector approach in handling health issues.
Okay, it's not just a one-stop. It's something that has allied.
Drays, there will not be any breeding ground for these mosquitoes. If they clear their cut their vegetation, they clear the grasses, there will be no breeding grounds for these mosquitoes, you know. And we know that waste also breeds mosquitoes. If they clear their waste or manage their waste properly, pack their waste, there will be no opportunity for, you know, no open defecation and open urination. Because we talked about this schistosomiosis. We know that the egg of this organism can pick it up there, and what the person will go down with, you know, that disease. There are a lot of, you know, environmental precaution strategies that can be used. We talk to people about the use of cleanliness, wash their hands when they defecate, and even wash their food safety. We also preach food safety to make sure that people wash their fruits, vegetable well, most especially the season that we are now. We have a lot. Recently, there's an outbreak of cholera. And what is the cause? We all know that hygiene is the number one. People will go down with these diseases. So we always sensitize the people on the cleanliness of the environment, cleanliness, personal hygiene, and then food safety. Thank you.
All right, quickly, she's just said food safety, and I know that also is within your own purview, because when
Food safety. Let's start with food safety, which is a very major concern to veterinarians. We, as in ensuring that we try as much as possible to ensure that the animal products, talking about meat, that goes into the market is like wholesome and okay for human consumption. Across the abattoirs and the slaughter slabs, we have our officials there who go about inspecting these meats to ensure that we don't have issues with cysticercosis, which is the cork tapeworm caused by Taenia solium. So that's one strategy that is used by the veterinarians. Veterinary Services Department ensure that this food safety is properly taken care of. Our officials are around all slaughter slabs and abattoirs inspecting all this meat, because it's seen in the muzzles, and once it is inspected, it is definitely condemned. It will not be sent into the market. So that's what we do concerning the food safety issue when it comes to the cysticercosis issue.
okay, but how regular or how sure are your veterinarian, that is your doctors now? Because I know in Asaba, a few people kill their meat without even going through the slaughter.
With pig farmers, where we do sensitization, we also do we educate them, on how to go about it. And we also know that these pig farmers, they also come to the clinic where we do proper treatment for these animals. We have association of pig farmers, and they register with us, so we understand. So that way we are handling that aspect of the farm that go to the slaughter. For those ones that are missed, assuming they come from somewhere else, they are handled also at the slaughter slabs or the abattoir.
Okay, so quickly as a follow-up to that, because particular about this, because pork meat it's a universal brand,
Okay.
that virtually everybody are consumed. So what's your role now in the actualization of health approach, the control of this natural tropical disease?
Okay, one of the major concerns we to ensure that we are able to do surveillance enough to sensitize people that we don't have outbreak of rabies. We are doing campaign vaccination and vaccinating dogs around to ensure, because once the dogs are vaccinated against rabies, we don't have issues with rabies. So our role is to ensure that these dogs are vaccinated against rabies. We also go about, we do education. We go to schools to educate the public on the reason why these vaccinations ought to be done, why they should vaccinate their pets, and then the clinics are open at all times. We're also talking about the cysticercosis issue. We do capacity training for farmers.
All right, I want Mrs. Francisca now to respond quickly, because I'm taking the route. True?
People that are doing the wrong thing. Some people, we went out last week, and we found out that a hotel was discharging its sewage into the drain. He was caught red-handed. If we didn't go out, we wouldn't have seen that. If we just sensitize past, we will say, oh, they are passing, they have just passed. But we always do house-to-house, inspection sometimes, because the local government is also there with us. There are other governmental agencies that are also doing the same with us. So we collaborate, and we do house-to-house inspection, we do sensitization, we go to abattoir, we go to the market. We have market sanitation days. On Thursdays are market sanitation days. We make sure that the markets are clean. We meet with the leaders of the markets to make sure that to pass the message, any message you have, through them to the market traders.
All right, thank you so much, Mrs. Mofena. You are a researcher, head research unit of the Southern Coordinator. As a researcher, what's your role?
Epidemiological studies. When there is an outbreak of any disease, we want to find where is it coming from, the root cause of the disease. That's one of our roles. Then we as researchers, we should be able to new innovation, novel things, like we need to we need to research on new treatments for all these entities. We need to research for new vaccines. So we have been using some treatments before now, using some vaccines before now, but things, there's technology. Every day new things are coming up. So we need to research on that, because you go to some communities, they say they use this to treat this. We can research on why this thing they are using in this community to treat such disease. Can we work on it so that we will have we improve on it to have new vaccines, to have new medicines for the treatment of these entities. Then we need to be able to have data and be able to analyze this data. The people that have received treatment, have they been healed or of these diseases? Then we should discontinue treatment. Then if there's need to also continue treatment, we need to know. It is data that will speak, and it is based on research work. Then anything we do on research, we should be able to implement it. Like there's research now that this One Health approach will help in the elimination of diseases. So where are we going to? We need the collaboration of all these sectors. So, and how do we collaborate? There's an NTD steering committee. We can invite these sectors, like the veterinary, like the environmental, then we in health and research. Then we'll be in that steering committee, so that we'll be able to eliminate these diseases from. Thank you very much.
I think that's a very good conversation there. 2030 is just around the corner. And that brings us to the executive director now, Dr. Inko. There's a lifeline, a timeline already. And what can government do to now expedite by way of facilitating the One Health approach in eliminating neglected tropical diseases as we round up this conversation?
Deltans, I want to tell you that you don't have to fear. Everything is in place. The Nigerian government, including our own sheriff in town, is doing a lot. Let me tell us the latest. The federal government of Nigeria and the Delta State government are into what you call primary health care revitalization. How do I mean? It means that as we are talking now, health facilities have been upgraded, renovated, modified, instruments put in place, personnel deployed, commodities also brought in. And in the nearest future, we look forward to having full complement of health workers, doctors, nurses, laboratory personnel, and all the others you see in a hospital, ready to provide healthcare services to our people. I told you earlier on that PAC is what you call it, the bedrock of the healthcare system. And we are not doing it alone. We are working in collaboration with Line Ministry. That's why I started by, first of all, thanking the Ministry of Health for providing this opportunity for us to be able to educate the public. And then also you have our friends here from Line Ministries. From the Ministry of Agric, you have the veterinarians working with us. You also have the Ministry of Environment working with us. We also have the Ministry of Education, especially when